afternoon, everyone. Thank you for joining us today. My name is Adeline Xiao, and I am the Acting Director of the Center for Biomedical Ethics at NUS. And it is my privilege to welcome you to this series of workshops on telemedicine organized by the Center's program, and also to say a few words of thanks at the beginning of this afternoon's session. As many of us know, Centers is a flagship program of the department, and for a full decade now has convened an annual conference on topics such as challenges of clinical ethics, as well as the impact of legal regulations and developments on healthcare practice, to name a few. And this year, the event focuses on another timely issue that we hope will stimulate a great deal of debate and discussion, and that is, as you know, telemedicine. While the event this year uses a substantially different platform, the time-tested activities for learning all remain: a panel session by experts, case discussions, short lecture, as well as a session to seek and collate input from all our participants. So the transition to an online platform this year has allowed us to host almost double the number of participants than we used to in the past, about 350 in all expected to join us over the 2 days. So let me start by just thanking everyone here, all of you, for your interest. And thank you for being both participants and contributors to this collective learning exercise. We particularly want to welcome friends from overseas, from our neighbors, Malaysia and Indonesia, as well as from countries further afield, including Vietnam, China, Mexico, Kenya, and the USA. Well, the use of telemedicine has accelerated dramatically due to the pandemic, and healthcare professionals, as well as patients and their families, have had to adapt very rapidly to changing needs and environments. And at the same time, many practical, ethical, as well as legal issues have risen to the fore. And some of these include issues of privacy, equity and access, concerns about standard of care, as well as patient-professional interaction in the virtual space. And so I'm really delighted that the workshops over the next 2 days are going to be addressing these important and yet complex issues. As a department, we are very grateful to many people. I just want to mention and thank our distinguished panel of speakers, our several workshop facilitators, as well as the team that has been working very hard to put this event together. I hope that over the next 2 days, you will find the talks illuminating. I'm sure you will, and that you will also be able to engage in rich and productive discussion. And I trust that the collective wisdom that emerges will form a foundation for informed and thoughtful practice in a healthcare landscape that is new and that is evolving. So thank you very much again, one and all, and I wish you a very pleasant and enjoyable 2 days. Let me now hand the time over to Sumi to start us on the first session, the expert panel.
Thank you, Adeline. Good afternoon, everyone, and welcome. My name is Sumytra Menon, and I'm the co-director of the Center's program at the NUS Center for Biomedical Ethics. We are delighted and honored to have 4 distinguished individuals on our panel today. Before we commence our discussion, I'd like to first introduce them to you. Associate Professor Chan Mayoke. Mayoke is a graduate of NUS. She trained in pediatrics in Singapore and subspecialized in pediatric hematology oncology in the Royal Marsden Hospital and Great Ormond Street Hospital in London. She's also interested in pediatric palliative care and helped set up a pediatric palliative care service in the KK Hospital in 2004. Mayoke is a senior consultant in pediatric hematology oncology and pediatric palliative care and is the chairperson of the Hospital Ethics Committee at the KK Hospital. Next, we have Ms. Rebecca Chu. Rebecca is the Deputy Managing Partner of Rajah and Tann, Singapore. Her expertise includes disciplinary proceedings for medical professionals and medical malpractice. She actively advises medical institutions and healthcare boards as well as medical practitioners in the area of medical ethics, malpractice, and management. Rebecca has represented a number of statutory boards in disciplinary proceedings and in advising them on various issues involving administration of complaints. The third member of the panel is Associate Professor Jingji. Jingji is a graduate of NUS and completed his specialist training in geriatric medicine. He is chairman of the medical board and senior consultant geriatrician at Tann Seng Hospital, and he is also an adjunct associate professor with the NUS Center for Biomedical Ethics. And last, but by no means least, we have Associate Professor Raymond Choir. Raymond is a graduate of NUS. He has an MSc in Public Health from the London School of Hygiene and Tropical Medicine and is a registered public health specialist and fellow with the Academy of Medicine, Singapore. His career has spanned public service and industry. In 2012, Raymond was designated as Group Director of the Health Products Regulation Group at the Health Sciences Authority. Since 2017, he's been seconded to the Ministry of Health as Group Director, Health Regulation, to oversee regulation of healthcare services and premises in Singapore so as to safeguard public health. Before we start with the first question, a quick note about your participation. We welcome your questions, but may not have time to take them all. Please submit your questions to the panel using the Q&A function in the Zoom webinar interface. Now, to start off the panel question, or rather the panel discussion, here's the first question, which I'd like to direct to JJ. How far should doctor responsibility go in ensuring privacy and confidentiality on telemedicine platforms, especially in multi-member households where others may inadvertently or intentionally listen in to the doctor-patient encounter? JJ.
Thank you, Sumi. Yeah, thanks for all those who are dialing in to participate in this discussion. I think, first of all, I think what the caveat here is that the standard expected for privacy and confidentiality should not differ at all from a face-to-face discussion in a healthcare facility. But I think because the medium is different, then the approach may be slightly different. So I would separate it into first of all the technology itself, the system, the use of the system. I think as a provider, be it the doctor or the service provider, when sometimes could be in a hospital, could be a private clinic, certainly it is a role of the provider who provides this telemedicine system to ensure that there's adequate technological protection for this system. So this would include cybersecurity of the session itself, that during the session no one could hack in and observe and listen in or watch in. And then when the data has been collected, the protection of that data, the cybersecurity, and the transmission of that information from the patient to the doctor and back and forth. All that there has to be a certain standard of protection. It's no different from a interaction in a clinic. Yeah, however, the extra context here that is beyond the four walls of a clinic is that the doctor is in a different locality from the patient. And therefore, there are certain conditions that that is not within the doctor's control, which is actually the patient's environment at home. And therefore, I think here, the doctor's responsibility is really to instruct the patient, to advise the patient that for this session to be completely private and confidential, you really need, the patient really needs to ensure that one of the prerequisite is that it can take place not in a noisy bus stop, not in a very public place. The patient needs to ensure that this occurs in a very private place, and that includes persons in the household that the patient may want to exclude from this session. So the patient themselves need to find that place that offers that level of privacy, and the doctor, of course, in his whether it's in his office, his clinic, will do the usual in ensuring that private environment. So the extra element here is really the physical environment that the patient needs to play a part, And the patient needs to be advised because of perhaps a lack of experience or understanding regarding the importance of privacy and confidentiality.
So that sounds like a partnership really between the doctor or the healthcare professional and the patient in managing that telemedicine consultation. I don't know whether Mayoke might have something to add when we're thinking about this in terms of dimensions involving children. Would there be any additional considerations that you would like to highlight?
Well, I mean, it really depends on the situation. And it depends on how old the child is as well. I think, as you all know, I mean, we see patients that span from really young to adolescents who are about to become adults. And this is probably the same even in the physical realm as well. I mean, a lot of teenagers don't really tell the whole truth when they are with somebody, with their parents or something like that. So then if they have, and obviously a lot of them are obviously more savvy with this telemedicine thing than their parents, I would think some of them. So then what's going to happen if the teenager logs on with the doctor without the parents' knowledge? Then whatever the teenagers tell you, should that, be considered confidential? We are talking about teenagers who are not, who have not reached the age of majority. So, less than 18, 21, that sort of thing. So I would think it should be the same as whether it's telemedicine or whether it's the physical consultation, that whatever the patient tells us should be private, unless it directly relates to something that contravenes the law, for example. But other than that, then I think we should extend this courtesy to the young person as well, to provide them the privacy, to assure them that whatever it tells us is going to be private and confidential.
So Mayoke, if I may continue along those lines, would that create complications in relation to whether a chaperone should be present for certain types of teleconsultation, especially if the patient is a minor?
Yeah, so again, it depends on the situation, and it depends on what you're going to do. Certainly, if it is something that, I mean, it also depends on the child themselves, whether they are comfortable talking to the doctor alone. A lot of times, if there is already a prior relationship built, a lot of times they are comfortable talking on their own. And again, like I said, sometimes the consultation is more honest when they feel that they are not being, nobody's looking over their shoulder, the parents, listening in or answering for them, a lot of them do that. So I would think, again, I don't think there's any difference between the physical consultation and telemedicine as to whether or not you should have a chaperone. If the child is somebody who is uncomfortable talking to an adult by themselves, then certainly a chaperone would help. Or if you are going to ask the child to show, a part of the body that you think might be sensitive, then I think it probably would be better to have a chaperone, unless you are really, you have known the patient for a long time. But even then, I think you really should be a little bit cautious, especially when it's going to be a part of the body that's a bit sensitive.
In that sort of case, would it be a chaperone on the side of the healthcare professional, right, rather than with the minor? Is that what you mean?
You mean whether a parent or whether it's going to be a nurse with me?
Yes.
Yeah, I was thinking that I think it might be better for both. If you really think that is going to be something that is really uncomfortable, I think it would be good for the parent to be there. At the same time, especially if you are dealing with somebody of the opposite sex, meaning a male doctor, looking at with a teenager female, for example, I think it would be good for a nurse to be there as well.
Thank you. If I could direct perhaps the next question to Rebecca. This has come up, I think, quite a number of times in speaking to healthcare professionals. A concern with if family members or the patient covertly records the teleconsultation session without the doctor's knowledge. How would you respond to that?
Okay, thank you, Sumi. It's no different from in-person consultation. A patient or a family member can also covertly record the consultation in an in-person setting. Now, I would divide the answer into two parts. First, if it is a family member that's covertly recording, I would question whether or not that recording has been consented by the patient. Certainly, it has not been consented by the physician, but whether it has been consented by the patient. If it's not consented by the patient, then there's an issue with confidentiality. And I think that will be a strict no-no. But if it is the patient that is covertly audio taping the session, there are no specific laws in Singapore that require a participant in a conversation to seek the consent of the other participant to audio tape or audio record the session. I mean, the laws have not developed in that way. As a matter of courtesy, obviously, the patient should have asked the physician for permission. But unfortunately, that's the state of the law at this juncture. So even if the patient covertly records, can the physician say, and if the patient seeks to produce that recording in a dispute in court, can the physician say, no, I did not permit the audio recording, and therefore the audio tape recording ought not to be produced as evidence in court. There are no such restriction. The best evidence rule still applies, and therefore the patient still is at liberty to produce that recording. The only question is whether or not the recording is authentic, complete, or whether it's been tampered with. But having said that, we do need to understand it from the patient's perspective. Why is the patient audio taping the session? It may not be to produce evidence against the physician. It may be that the patient has problems remembering the medical advice that the doctor is giving, or maybe the patient needs a record because he or she cannot quite process the information at the spot. So perhaps there should be some communication with the patient if the physician realizes that the patient is audio taping, maybe to understand the rationale behind that. And sometimes it may not be a bad thing, because if you know that the patient is audio taping, you will want to be able to give the patient complete and honest information that is for the benefit of the patient. Sumi, I hope that answers the question.
I think it does very well. I recall, I think, JJ, you wrote a piece in an SMA newsletter about this, encouraging doctors to be open to having their consultations recorded. I don't know if you want to add anything on that before I ask Raymond to say a few words.
Yeah, I think maybe the only thing to add is to advise that the patient that, if the doctor knows that the patient has made a recording, that the patient should protect his or her own confidentiality, and that duty is on the patient because the patient is in possession of that material.
Okay, well, thank you very much. Raymond, welcome to the panel. May I ask, what are your reflections so far on the comments that have been shared by your fellow panel members on the issues relating to privacy and confidentiality in telemedicine?
Thanks, Sumi. I think the views that has been shared so far from the speakers have been very good. I think it's actually been quite in line with what we have been trying to develop with regard to the telemedicine e-training that we have tried to roll out to all doctors. In fact, from a regulatory perspective, I think telemedicine is actually not regulated under the current legislation at the moment, and that's why in MOH we have developed a regulatory sandbox to actually get the telemedicine providers in, so that we can actually work with the telemedicine providers to see how we can license and regulate this new modality of medicine itself. And that's why over the last 2 years, I think we have gathered quite a lot of learning points through the rollout of the regulatory sandbox. And I think we have during the past 9 months of the COVID experience, we've actually gotten quite a lot of interest and many medical providers joining us, to roll out the telemedicine. And through this, I think we have then tried to see how we can put together some of these learning points into an electronic training platform for the medical providers itself. I think through this experience, I think one of the very important things that was mentioned, I think it's very important that during the start of the consultation, it's very important to actually highlight and articulate to the provider, what limitations of telemedicine are, including also asking them, whether there are anybody that's around, the consultation in the environment that they are in, which could limit their which could limit the privacy, and whether they are okay with that. And at the same time, not just at the patient's environment, but also in the doctor's clinic environment, if there's anybody who is in, let's say, if they want to bring in a chaperone and all these things, to also articulate to the patient so that the patient knows who is actually around the telemedicine environment. I think besides the environment, I think one of the other points that we will be putting into the regulations for telemedicine that will be coming out in the new Healthcare Services Act sometime in next 1 to 2 years will basically be looking at how we want to ensure data privacy, including confidential, including the cybersecurity standards that we need to put in. I think data is something that is very important, especially for healthcare data. And in this telemedicine environment, how do we store the data? It's very critical. And I think this is where we found that actually during the rollout of the telemedicine environment, most of the, I would say, cybersecurity awareness and standards is actually quite rudimentary, especially in the small medical providers. And if you want to come on board telemedicine, I think that's where it's very important to ensure, a better understanding and appreciation of what the cybersecurity standards are. And then we also, from a ministry, would like to now come up with these standards and then work alongside with the medical providers, educate them, see where the gaps are. If possible, we would also want to see how we can level up the cybersecurity standards so that we can actually see how to better protect patient data when they come on board the telemedicine environment and consultation.
Thank you, Raymond. One of the issues, and I'd like to, I think, direct this question to actually both JJ and Raymond. JJ for your more clinical perspective and Raymond for more of the regulatory perspective. And the question really relates to charging and fees. In speaking to a lot of colleagues about charging and fees, they raised the question about how ethical it was to charge for telemedicine as though it's an in-person consultation. And the reason that has come up is because quite a lot of these healthcare professionals currently, speak to patients on the phone and may give advice, or they may do that on a messaging platform, and that's currently not charged for. So moving forward with telemedicine being, used much more regularly, and of course all the charging mechanisms that will be created for it, these concerns have arisen. So perhaps I could ask JJ first for a clinical perspective and then Raymond.
Yeah, I think from the clinical perspective, first of all, I think we need to scope out what exactly qualifies as telemedicine or as the practice of telemedicine. Once we have decided that, then suddenly it becomes, then whether to charge or not, really, whether it's ethical to charge or not, really depends on, are you rendering a service of value to patient that consumes resources and consumes professional time and so forth. And if the answer is yes, certainly I think levying a charge is justifiable. But how much that charge is certainly a mixture between, I think the same principle of what you charge in the clinic would apply. It depends on the cost that is, the amount of cost that is involved. What sort of cost are you saving for the patient, for example, the opportunity cost saving, travel cost saving, and for the doctor itself, there can be some saving of, in terms of efficiency, productivity, and so forth. But our experience in the clinic during this COVID period is that one mustn't assume that telemedicine itself is cost-free or is certainly cheaper. I think if you do a careful study, because some of the extra precautions if you have to take actually would incur a new set of costs by itself. But I think if you ask me for justification, it really depends on the upstream question is really whether this is a service that is of professional value to the patient, and whether resources are consumed, and then what sort of resources are consumed, and that would determine whether are you overcharging or not, and whether that charge itself is reasonable. I think one other thing would be that at the end of the day, we can't assume that there's always subsidies from some other, maybe in a public service, people may find that there can be cross-subsidy, but we have to create a framework that is viable as well for the private practitioners, and that should they decide that this is a service that is of value, then they should be allowed to recover costs in the minimum, and at least charge, something that is viable, because professional time is consumed in interacting with the patient, albeit a different medium.
Thank you, JJ. Raymond?
Hi. So I think JJ has covered actually, how in terms of the charging of the fees, what are the proxies to actually ensure fairness in the way the doctor should be charging the patients. From a regulatory perspective, there's actually, I don't think there's actually currently any legal structure, in which how the fees should be structured itself. But like I think JJ has provided some proxies in terms of what are the nature and complexity of the services that are being charged, how long they are being charged, how long they are being seen, what are the expertise that's needed, as the skill sets, what are the devices or services that are being rendered. I think these are the usual proxies that we use to see whether, the fees that are charged is actually quite fair or not. I think one other important perspective, from a regulatory perspective, is to ensure, and that's where something which we will try to ensure is to make sure that the fees charged are actually made transparent to the patients. So how do we actually make sure that some of these fees are actually published, within, let's say, the telemedicine provider's website, to ensure that, the patients know what the fees are before consuming it. If not, actually at the start of the consultation, the doctors should also, let them know what the fees charge, or if there's any change in the treatment, like for example, if they want to do certain or render certain kind of additional services, or make them sign on certain additional packages, in terms of, let's say, for further follow-ups, some of these changes in the fee structure should be made known to the patients before, proceeding. And I think that's where it's important to ensure that the fees are made known, made transparent, so that the patients can actually make a proper informed decision on, how to proceed with some of the fees.
Thank you, Raymond. So it sounds like transparency will be a key issue in terms of how the charges are explained and laid out for people. And perhaps there may even be different types of charges for different sorts of telemedicine, depending on what kind of consultation it happens to be. Thank you for that. Keeping on the theme of justice, if I could direct the next question to Mayoke. How do the differences in patients' health literacy affect the quality of telemedicine? And do doctors have an obligation to address deficits in health literacy?
Yeah, I mean, certainly it is going to make a big difference. Somebody who, I guess when you talk about health literacy, first of all, you talk about the knowledge about the patient's health itself, and the knowledge to communicate that. So whether it's through the new platform now, so somebody who is, not familiar with e-platform and all that may find it very difficult to use it, and then that's going to affect your consultation. Somebody who is not able to communicate well their concerns. I mean, I deal with children and teenagers and stuff. So obviously for them, it's going to be a problem especially when you rely a lot on body language, talking to them, persuading them and all that, and that's all going to be lost over the screen, right? And so certainly it's going to cause a big impact on the care itself. So I think we have to be aware of our patients' knowledge, and sometimes even the knowledge about the medications they are on. Sometimes a lot of them don't know what they are on, what is for and all that. And so usually we will either if they can bring their medications to the consult, we see it. And so now it's going to be over the platform again, over the telemedicine platform again, which is a whole new ball game altogether. So certainly, I mean, we would have to know our patients well to decide whether this particular patient would be able to navigate the system, would be able to navigate his own health care knowledge before deciding whether this person is suitable for to be consulted through an e-platform.
Thank you, Mayoke. I mean, that could create some complications. In many ways, some of the patients who would most benefit from telemedicine consult could be the ones with the lowest health literacy. So what obligation, if any, ethical or otherwise, do you think we have? And this is an open question to all four of you, to try and enhance the health literacy of our patients and their family members?
I think, again, there's no difference between, a physical platform and e-platform, right? I mean, education, and if you can get the family members involved, I'm also conscious of the fact that, I mean, even in the elderly, that's also going to be a problem. So that also would help as well.
Yeah, I agree, Mayoke. Actually, trying to get the family members involved, to try to enhance the health literacy, will be important. I think, especially if we are advocating, because a lot of times, now we are trying to move towards teleconsultations for, let's say, for the chronic diseases. And I think that's where, when we want to move someone on board, someone to, take on some of this teleconsultation for the chronic follow-ups of the chronic diseases, I think it's very important to then check with them, how comfortable they are, and and if we want to onboard them, then that's where the doctor's responsibility is to see how we can ask the family members to help their parents, if they want to come and join the teleconsultation, to see how we can onboard them. And if there's a need to, if it's a large setup, they can actually even offer some tech follow-ups, in terms of trying to ensure that the teleconsultations are followed up successfully going forward.
Thank you very much. I think we've got a couple of questions that have come in through the Q&A feature. And yes, you can see them on your screen now. Is medication delivery via telemedicine allowed? And how do we prevent fraudulent abuse of medical certificates over telemedicine? This might be one for Raymond, I think.
Yeah, so I think for telemedicine, for the delivery of medicines, actually is allowed. Most of the time during the e-training itself, I think one critical element that we have tried to put in within the training is to ensure that it is follow up with the delivery of medicines. And we want to make sure that when we look at the delivery of medicines, we've actually came up with this Singapore standard, which is the guidelines for the supply and delivery of medications, which we have worked together with the Pharmaceutical Society on. And it provides a very clear guidance in terms of what are the need for the storage, the security, and how these medicines should be delivered, let's say, from the clinic to the patients, and what are the information that's needed, to be provided to the patients. Either, you could accompany it with the medicines, Or the other way is to actually follow up with a phone call to make sure that, you know, some of these medicines, how to consume them, you know, what are the safety issues to watch out for, is actually accompanied during the medication delivery itself. I think we apply this to both the medical clinics as well as the retail pharmacies, because we do know that some of the clinics actually do tie up with the retail pharmacies to also send some of the medicines over. I think recently we have also tried to see how we can enhance that, you know, to also look at getting some of the addictive medications. Let's say if there's a need to, you know, if there's no change in any dosages, that can also be delivered, you know, through the to the patients itself. But of course, if there's any change of dosages, when there's any need for a review of the medication because of the patient's medical condition, that's where I think we would then say that, you know, you actually need to come back with a follow-up, you know, before you can allow, you know, some of these medication deliveries to be to be carried out.
Just Sumi, can
Yes.
I just add that one of the safeguards that can be added on, assuming in an institutional practice, is that after the medicines are delivered, or even before, you see, usually in a real practice, the family would collect the medication from the pharmacy, and the pharmacist would provide counseling with regards to the medication. So what we have put in place is also for the pharmacists in selected cases to do this via teleconferencing, to be able to give advice over telemedicine platform on the medications, especially when there are new medications or change in dosage, as Raymond has mentioned.
Thank you. I think the second question that we had earlier on the screen related to medical certificates and possible fraudulent, you know, MCs being issued. Would you be able to address that?
Well, one of the safeguards is actually, you know, I mean, if I know that there are some regulations from days of gone by where only a true paper MC is a real MC and electronic MCs are not recognized. So we should actually innovate, and one of the safeguards is that as the MC is transmitted electronically to the patient, it should also simultaneously be transmitted to the employer. Or the reporting officer of the patient, so that there can be no alteration, you know, they should match. So that's one of the safeguards that we could consider moving ahead. Yeah, because it doesn't make sense that we have made everything electronic and finally for that piece of paper, you have to actually mail it or for the patient to come and collect it and so forth. I think that seemed to be lacking that last 9 yards for us to complete this whole picture of benefiting the patient.
Thank you, JJ. I see actually we've got quite a few questions coming through. Here are a couple more questions to do with overseas patients, and specifically guidelines on providing telemedicine consults to overseas patients, and also a legal and regulatory question in relation to contravening any laws in the provision of that telemedicine consultation. Perhaps we'd like to start with guidelines, or maybe we should ask Rebecca. Rebecca, maybe you can start perhaps with a legal kind of overview.
I think the concern with that question is whether or not if a doctor, say for example, a Singapore registered doctor, were to render a treatment or medical advice over telemedicine platform to a patient, say, situated overseas. And the question to be asked is whether or not the doctor will be at risk of breaching the regulations in that jurisdiction in terms of the practice of medicine. So perhaps when the doctor wants to embark on this sort of treatment, they should check on the regulations over in that jurisdiction and whether he will be at risk of breaching those regulations. I think from the Singapore perspective, I believe that if a UK doctor wants to administer treatment or medical advice to a Singapore patient over telemedicine, I believe there is regulations that require licensing for the UK doctor. So similarly, I think these should apply, and whoever that wants to administer or render treatment for a patient in an overseas jurisdiction, they have to take care of the fact that they might be breaching a regulation or a law in that jurisdiction.
Raymond, would you have anything to add from the MOH perspective?
So I think like what Rebecca has mentioned, there are two ways. So if you have a local, let's say a local doctor going overseas to render that telemedicine consultation for overseas patients, I think first of all, they have to make sure that they are aware of what the regulations are overseas. I think that's the number one point. I think number two, that's very important, is when they provide such teleconsultation to overseas patients, it's no different from providing a teleconsult to a local patient. And they should similarly state what the limitations of the telemedicine are. Especially, when, I mean, these patients, even if you see them, if you detect anything, they will probably be not able to just come down, and see you in person. I think that limitation must be stated upfront. Whereas if you have a Singaporean patient, if let's say, even if you detect something wrong, you can say that you can come down, or I can make a house visit to see you. I think that's one big important point to take note of. The other thing I think is important to take note of is depending on what kind of consultation we are talking about. Most of the time I see that some of these overseas patients are coming for a second opinion, medical opinion. And it's very important to then state upfront, that these are second opinion. If there are any areas that are unclear, they will probably need to undergo certain further investigations, or if they need to link up with the, overseas doctor, to get more information. I think that's something that's important to take note of. On the converse, if you have a overseas doctor that are coming, and setting up, let's say, a telemedicine platform, or coming to actually see a local patient in our local context, then that's where the overseas doctor will probably need to get a registration, let's say a temporary registration or conditional registration, to actually be allowed to come in to practice medicine during that period of time, to actually see the patients, see our local patients. I think this is something that we will be putting in our regulations, but it will probably be not easy to enforce, because we do know that with the digital platform, actually anybody can just, go and see any doctors, over any overseas platform. I think this is where we will also want to include consumer education, to make sure that they understand what the limitations of actually going into another overseas platform or website to actually be reviewed are. It's no different from actually anybody just going overseas and buying, let's say, a health product, which is not registered overseas. Similarly, if they go onto such overseas platform, they must know that these are not registered, and it's a caveat emptor approach. And therefore we would still want to encourage them to any local patients to actually see a local registered platform or practitioner, so that they can actually get the legitimate medical advice.
Thanks, Raymond. That sounds a little bit like a minefield, and healthcare professionals should tread a little bit carefully. Well, the questions keep coming in from the from the audience, and here's the next one. Is telemedicine headed towards increasing the burden of care for informal caregivers? Perhaps I could direct this to Mayoke, and then perhaps JJ can also weigh in about whether telemedicine, does it actually mean potentially that informal caregivers' burden of care might be increasing?
So with that, I take it to mean that now we are expecting either the parent or the daughter or the son or whatever to take over the care. And again, I think there is no difference between even physical platform, because if you have somebody coming in to see you, you would hope that you will have the help of the surrounding, the family members to help to take in the care. Whether it's to ensure that somebody takes the medicine correctly, somebody who is not able to see, for example, so well, or somebody who's not able to understand and all. So I don't think there's going to be a big difference, but I think the fear is whether the right person who is attending the telemedicine consult is going to be the same person that's going to be delivering the care. I mean, the appropriate caregiver is the one that's actually in consultation with you, and that's going to be difficult to enforce because you have no idea who else is there at home.
Yeah, I think I think that telemedicine is like one of those double-edged sword that unfortunately the people tend to focus quite a bit on the disadvantages or the fears. But I think that in truth, many caregivers actually appreciate the fact that they don't have to make an appointment, go down to the clinic and meet the doctor just to answer some queries that they have and some questions that they have. It's just that I think already a lot of these days, a lot of caregivers do call up the clinic and want to speak to either the nurse and sometimes even the doctor. And I think they would, what we're doing is just making it more structured, setting certain objectives for that interaction. But I think it does mean that informal caregivers would be able to get appropriate information in more timely fashion. And also that certain questions and queries can be answered, and even certain educational material can be pushed through some of these medium and ensure that the quality of care is good.
Thank you, JJ, for that. We do have quite a number of questions coming in. Here's the next one. Collusion is a difficult area in palliative care. Can the panel comment on how telemedicine can impact issues of collusion?
Okay, I think I suppose collusion here means that the family may want to talk to the doctor without the presence of the patient. I think that the same principles of ethics would apply in a face-to-face situation. We do not generally, I mean, our principle is not to talk to the family unless you have the patient's consent, assuming this is a patient who has mental capacity. And therefore, I think the same would apply for a telemedicine platform. And there shouldn't be any reason why the family would want to do that. And even if they do that, I think the doctor has to make it very clear that, this conversation, the content of this conversation, this communication would be shared with the patient. And I would want, and I think it's best practice to have the patient's consent, in a, whether it's a narrow or broad way, or whether you could speak to any particular family member of the household. I think this is just part of our duty of confidentiality, and even for a patient with a cancer condition, which is common where the collusion usually takes place. I think we have generally in real practice moved away from the practice of collusion, unless there are really some therapeutic advantage of doing that. Otherwise, I think whether it's face-to-face, whether it's through a telemedicine platform, there shouldn't be any different.
Thank you, JJ. I'd like to throw in a sort of legal question here, but it's legal and regulation related, which has to do with quite a number of providers who have long terms and conditions in their apps for telemedicine, right? So these might be some boilerplate disclaimers. So I suppose the question relates to the parameters of patients' understanding of what a telemedicine session can and cannot provide. If there are layers and layers of these terms and conditions that people may not necessarily agree to and just click agree, like everybody probably does with their iTunes account or whatever it is, and how ethically acceptable that would be in the context of a healthcare provider-patient relationship. Maybe I could ask Rebecca first to comment.
Yeah, I think that in any use of the platform, you will expect that the providers will have their terms and conditions, and I think it's there's nothing wrong with that, because I think that is how they would need to set up their platform, and they need the understanding of the users as to what are the parameters within the use of the platform. And in fact, in the SMC ethical code, it's already highlighted that if you want a patient to agree to consult over telemedicine, there must be consent obtained from the patient. The patient must understand, the whole idea of telemedicine, what it encompasses, what is expected from the patient, what are the limitations, what are the issues with confidentiality, what are the issues with data that's going to be disclosed to the provider, if any. And all of this, I think, is quite a lot of information. And sometimes this information cannot quite properly be transmitted through just a conversation. And sometimes I would say you need to set it out. And I do understand your concerns with boilerplates. Yes, sometimes it can be written with such legal language and no one can understand. And we advocate that if you are going to put in a terms and conditions, it should be written in a layman's language that everyone can understand. And I do think that it's quite important to set it out clearly and to give the patient and their family members time to process what this all means, signing up to this platform and agreeing. And more importantly, before the consultation, and I do want to emphasize that the boilerplate must have the involvement of the physician. I don't think, and I don't agree that a provider, you rely on a provider to come up with a boilerplate. I do think that if the physician wants to use telemedicine platform for their patient, they should carefully review the terms and conditions that they expect the patient to sign on. They should advocate for the patient that the terms and conditions should be fair. I know this is difficult because you're talking about providers. But before the consultation begins, I would advocate that the physician should run through in summary form some of the issues with telemedicine, the limitations, and then get the patient's consent to proceed. That is what I would advocate. And very often patients know quite well, and most of them are very educated. They would understand the parameters, but the question is to ensure that every patient is in a position to exercise informed consent. And that is how I would go about doing and taking that consent.
Thank you, Rebecca. I don't know if Raymond or any of the other panel members may want to jump in here.
Just to add that I think professionally, for the doctor, whether he's a provider or solo practitioner provider or whatever, I think it's important to know the objective of why you're setting up this telemedicine platform, what you hope to achieve, and as Rebecca says, what are the goals and limitations. These need to be very clear, and also the context, because I think at the end of the day, there is this issue about, does your technology match your objective? For example, if you're a dermatologist, you want to diagnose, is the resolution good enough for you to make that diagnosis? And therefore, my caution also to doctors and providers is that you must not oversell the ability of this platform, and of course, hence the limitation of this platform. Because if you do that and you fail to achieve that, then it becomes a big problem downstream, and your informed consent is therefore inappropriate.
Thank you, JJ. Raymond, I don't know if you wanted to add something to that?
Yeah, I think what JJ has and Rebecca has mentioned, in terms of the, I think at the start of the consultation, that's where it's very important to make sure that you establish, well, we don't have that patient-doctor physical interaction, but you definitely have this first patient-doctor e-interaction in which you have to then set the expectations right. I think most of the time, and actually it's not much different from an in-person consultation, in which you want to make sure that expectations, the limitations are set up right. Just that, in a virtual or telemedicine consultation, a lot of times you don't have the three-dimensional view to actually be able to see the patient, in real time. And that's where the limitations must be brought up front. But I thought besides the professional, the technological limitation, I think we also mentioned just now about even the pricing, what the price transparencies are, as well as also what the follow-ups would be. That's also something that's very important. I think one other point that was also raised as part of the professional obligations during our rollout was that if, let's say, and some were very worried that, in the event if, the patient should see, the doctor should see the patient and halfway something adverse happens and you won't even know where the patient is. How do you actually reach out, to the patients? I think this is where we even trying to establish the location of the patient, would be important, so that in the event if something adverse do really happen, then at least, medical assistance could be supported to be given to the patients much faster, yeah. So I think trying to establish the different information, trying to establish the expectations and the obligations will be important.
Thank you, Raymond. We have yet another question from the audience. In terms of cybersecurity for the different platforms, is there a preference? And relatedly, no matter how secure, these platforms could be hacked. If we've done our due diligence, how much liability could we be exposed to if the session was hacked or bombed? So I think this is one for Raymond and Rebecca, maybe.
So
Maybe
in terms
I'll
of
just-
the, sorry, Rebecca, you want to go first?
Okay, so I think the question is what is the obligation of the physician and the obligation of the provider? Okay, and I think the obligation of the physician, if they're using a platform, you must use a reliable platform. Don't use platforms that are unreliable, not tested. And I think it's your responsibility to the patient. If you're going to use a platform, you must do your due diligence to make sure it's secure. I don't want to comment about Zoom and Microsoft Teams, because I think that there's a lot of talk about whether or not one can hack into Zoom or Microsoft Teams. But the question and the responsibility of the physician is that you have to make sure that you have done your part in ensuring that you choose a platform that is reliable, that is not going to be at risk of any attacks, cybersecurity. But having said that, and I'm now turning to the provider, having said that, technology is evolving. Hackers are always getting smarter and smarter. We can't prevent a hack sometimes. But the question is, the providers then need to have that backup and assurance and plan. If there's a hack, what are we going to do? And that, I think, is the responsibility of the provider. Raymond, maybe you want to add to that.
Yeah. So I think before you even try to subscribe to a telemedicine platform, or if you are even ambitious to develop one, I think that's where it's very important to ensure that you understand, by going inside this cybersecurity platform, what are the end-to-end encryption that has already been, put forward. Understand, let's say, even if you don't understand, I think it's very important then for you to try to get an additional independent assessment of what the cybersecurity risks are, whether they already have certain solutions that have been put in, what are the different encryption they have put in, etc. I think some of the platforms even provide kind of 2FA, two-factor authentication, for some of these consultations. And I think some of these are safety features that have been built in, to ensure the cybersecurity of the platforms itself. So I think making sure that there's due diligence is very important. I think what Rebecca mentioned in terms of what you should be doing, if there's hacking, would also be important. I think the third point is also something to do with the individual responsibility. I think nowadays, we also want to make sure that laptop or the computer terminal that we use to access the telemedicine consultation should be actually well protected. So we have found that most of the time you should install certain kind of antivirus software, not some free ones that you download. Because most of the time I often find that when we go down to certain providers, then we find that because it's free, you download it, and then how do you actually know whether it's safe? So trying to make sure that you get a reliable antivirus software, trying to also try to pick up what are the signs, so if you have some kind of signs where you actually see certain abnormal activities being flashed out on your laptop, then or on the platform, then something is wrong. Because the problem is most of the time, all these websites that you go to, it all depends on what kind of websites you go to. So you must also make sure that you try to ensure that that platform that you use for telemedicine consult, that laptop that you use, or the server that you use to store all the patient data should be somewhat quite protected, you know, and not some laptops that you actually use to, let's say, do a lot of Googling, you know, and all those things, you know, because a lot of times the more websites that you access to, the more apps you download, you know, it actually increases the attack surface area by the hackers. You know, if you have only just one single laptop, and that laptop is just dedicated to telemedicine consultation, you have actually hardwired it, you know, you have protected it by antivirus software, don't use it to access internet at all. You know, I think that it itself, you know, actually do ensure the protection itself. So I think the trying to make sure that, you know, we ensure the cyber security and data privacy for the patient is something very important.
Thank you, Raymond, and all the panel members. The time has absolutely flown, and it's almost 3:30. Before thanking you, I'd like to, if it's okay, please invite the audience to take part in a quick feedback poll. And while we launch that, I'd like very much to thank the panel members. It's been a very active discussion today. Thank you so much for all of the audience members for participating so actively. And of course, thank you so much to Mayo, Raymond, Rebecca, and JJ, who've been wonderful panel members and, you know, have really engaged us in a very interesting discussion on the ethical issues of telemedicine. So before we close this session, which will be in a minute or two, because we are going to be taking a short break, and in 20 minutes at 3:50, if you've signed up for the small group discussions, we will start up again on a new Zoom link. And that Zoom link, if you've signed up for those sessions, should be in calendar invitations that were sent to you. And that begins at 3:50. So you can have a 20-minute break before we get back together again. But please join me in thanking virtually, clapping virtually, I suppose, all the panel members today. It's been a lovely session, and we'll see those of you rejoining us at 3:50. If not, we'll see you tomorrow morning when we have a talk by James Lowe on ethical issues in relation to carrying out telemedicine with nursing home patients and specialist outpatient consultations. So thank you very much again, and see you again soon. Thank you. Goodbye.